This is Gonzaga Health and Counseling Services, and we thought we would put this together for Gonzaga University nursing students. We've had a lot of reach outs and calls and visits lately requesting some additional help reviewing the CPNW requirement, the clinical passport that you've been given, and the requirements, and trying to figure out what you need to do as a student. So thought we would put this together to see if we could help clear up some things for you to make this a little easier to navigate and to explain how health and counseling can help support you in this process. So you've all probably seen this document. If you're a nursing student and you're watching this video, you are probably very familiar. We understand that it's confusing. There's a lot of clinical terminology in here, just a lot to parse out. So we're going to go through each relevant section one by one, focusing particularly on the submit once side, kind of that first step clearance. So first things first, you're going to want to go ahead and gather your immunization records. There's a very good chance that we have the majority of those records already that you would have submitted as part of your enrollment as a new student at Gonzaga a couple years ago. You can access that by going to the Gonzaga Health and Counseling website, gonzaga.edu/health and counseling, and just clicking on the Health Portal banner. Or you can go directly to the web address we've posted here, which is the gonzaga.medicat connect. At either of those ways, you're going to come to that blue single sign-on Gonzaga screen where you enter your username and password to log into the system, and then visit the immunization tab in order to be able to see your records. If we don't have your full immunization record, there's a good chance that maybe it didn't get submitted in full. We only require measles immunity here, so maybe you only submitted that. You're going to want to go ahead and locate the rest of your records. We've listed out places where you may be able to find those records in their entirety at gonzaga.edu/findmyims. Lists out all those sources, ways to connect to them, and tries to make that as easy as possible. Keep in mind, you're going to need to upload actual copies of this information, and it's going to need the day, the year, and the month next to that of what you got and when you got it. So you're going to want to get actual copies. Verbal report won't suffice here. Okay, so we're going to jump right in and we're going to tackle which is the one that's probably most confusing to students, which is the tuberculin status, the ruling out tuberculosis. So first bullet there, what you need is documentation of an initial two-step TB skin test and documentation that it was completed, meaning documentation that it was negative and that it was read in the appropriate time frame is what they mean there. We're going to go into a little bit more detail on the timing of that here in a minute. But for most of you, this is what you're looking at, is this two-step initial TB test. If you have never had a TB test that's been positive, or it's been more than a few years, you can supplement this with a Quantiferon. We're going to talk through that in detail. For most of you, however, all this paragraph means is first time around, you need to do a two-step TB skin test. After you do that, you can go to a one-step starting next year. If you happen to fall into a very rare category of previously having had a positive skin test, the skin test that you have is positive, which means you have an induration, you have a little hard knot where we place the tuberculin formula under your forearm skin. If you have a history of BCG vaccine, which is very rare for those of you who were born in the United States, come on in, talk with one of our triage nurses. We'll help you figure out what to do here. Those last three bullets are not going to apply to the vast majority of folks. So a two-step skin test, also known as a PPD. One thing I want to tell you, this process is very particular about the timing, and they will reject the test if it's not done exactly as required. So with a two-step PPD, you need to get the placement, the read, the placement, and then a read. So your first visit, you place the PPD, 48 to 72 hours later, we have to read it, and that's a hard cap. You can't come in any earlier than 48 hours. We will literally have you sit in the lobby if you're 10 minutes early, and you can't get it read any later than 72. That's the standard, and they'll reject it if we don't follow it. Visit 3 is going to be 1 to 3 weeks after visit 1. So if you come in on April 1st for your first PPD, your second PPD can be placed no fewer than 7 days, no more than 21 days after that first PPD. So really watch your timing to make sure that you're going to be around to come in during that 1 to 3 week range to get your second placement, and be sure each time you get one placed that you're going to be around 48 to 72 hours later to get it read. For this service, it is something you can do in health and counseling. The undergraduate nursing students have access to health and counseling services, so you can come in, $30 for each skin test, $60 total. That includes the read, and it's a walk-in. So you can walk in anytime it's convenient for you. Except for Thursdays, I should make that note, we're not able to place PPDs on Thursdays because no one is in the office 48 to 72 hours later, which would be Saturday and Sunday, to read the skin test. And then you'll want to do a release of information form probably on your 4th visit for to get a copy of those skin tests so that you can then upload them into the system. Lots of conversation this year flying around about the Quantiferon instead of the 2-step skin test. So the Quantiferon Gold, or T-Spot, is listed on your clinical placement passport document as the TB IGRA. We do understand the benefit and the appeal of this, particularly if you're in a situation where you don't have 3 weeks left in order to do a 2-step PPD. You may be in a situation where you have to do a Quantiferon Gold if you have a hard deadline on being able to provide this information because of the timing. However, in this particular test, instead of placing, the small amount of tuberculin under your skin like we do with the TB test, this one we actually draw your blood. Now, you need to know these tests are usually very costly. Quantiferon Gold is typically $150 or more, and it usually is not covered by insurance. Results usually come back in 5 to 7 business days. If you get the Quantiferon, you're going to have to get a 2-step TB skin test next year, or whatever year you start using skin test instead of Quantiferon. So if you get a Quantiferon every year for the rest of your time at Gonzaga, whenever you come off of that routine, you're going to have to get a 2-step. It's just the process. Most of us in the healthcare industry only use skin tests because of the cost of the Quantiferon, so at some point you're likely going to have to switch. So keep that in mind, that if you do a Quantiferon this year, you're either going to have to Quantiferon again next year, or you're going to have to switch to a 2-step TB skin test. Something else to keep in mind if you really are considering the Quantiferon and you think your insurance is going to cover the cost, you really want to be sure when you call them that you talk about the following. First, you want to make sure that they know that this is related to TB screening and is not due to medical necessity, which is something that would happen, for instance, if you were exposed to someone with active tuberculosis. You need to tell them which lab will be drawing and where which doctor will be ordering. Health and Counseling Services is not able to draw for this particular test due to the type of processing and the incubation that has to happen with it. So we would need to send you with an order to a local lab. If you're going to do this in Spokane, Health and Counseling would write that order, and LabCorp would be the lab that would draw it. Health and Counseling is out of network on all insurance plans. We do not enroll in insurance. So you need to know that it's going to be an out-of-network provider who's ordering it. Further, Washington State is very likely out of network for you if you are from another state. And for those of you who have coverage where you only have emergency care coverage out of your network, you very likely do not have any coverage to get a Quantiferon Gold test because it is not emergent to get that here in Spokane. So you need to make sure when you're having that conversation with your insurance that you're really talking that through if you think that it's going to get covered by your insurance. If you still wish to proceed with a Quantiferon, we can order this for you. Come in and ask to see a triage nurse. They can facilitate that process for you. So, a note about timing. This a little bit pertains to the TB skin test, and it pertains to all of the vaccine sections that we're about to hop into. the clinical placement passport requires significant attention to the details, particularly around timing. They talk a lot about appropriately timed doses. That means that doses need to be administered consistent with the CDC schedule, which I've listed the website here for you, cdc.gov/vaccines/schedules. The key piece about that timing is usually the minimums, right? You must get 2 doses no less than 1 month apart. It doesn't matter if it was a year apart, but it does matter if it was less than a month. So when they're talking about timed doses, watch for that. You're going to want to be conscientious with the 2-step TB skin test, because if you don't follow the process of the timing, you have to start over. You want to be cautious with TB skin tests and live vaccines. You can't administer a TB skin test within 4 weeks of a live vaccine, which includes both MMR and Varicella. So as you're watching all of the timing of the things that you need to make happen before your due date, be careful about what you're doing here, so that you, for instance, don't push yourself back by a whole month before you can get your TB skin test because you had to go get a varicella vaccine. So just watch that, and if you have questions about timing, call us, stop in, ask us. And again, study abroad. This is very common, given the timing of when you're working on your clinical passport, that study abroad can get in the middle of all the things you're trying to do here. So watch your timing, talk to us if you're not sure, and plan ahead. So let's start to talk a little bit about the vaccines that are listed as your requirement. So hepatitis B, very important for healthcare workers. We know this. The clinical passport requires documentation of 3 vaccines, again, completed at appropriate time intervals, and that's a key word there, and a titer at least 6 to 8 weeks after series completion. If you had your 3 doses as a child, you're just going to get that titer now to see where you are. So if you have 3 doses on your immunization records, proceed to the titer. Typically 24 to 48 hour turnaround for that. For undergraduate nursing students, we can draw this in health and counseling services, and it is a walk-in service. The cost is $20 cash credit Bulldog Bucks student account for the phlebotomy, and then we'll send your insurance card to the lab with your specimen. Again, insurance coverage is very specific to your plan, where you're from, etc. But we'll give it a shot to see if they'll cover it. If it's negative, and we see about 50% come back negative, 50% come back positive, we do see a really good response to students who've converted after the 4th dose, that challenge dose. So most students, if they get a negative titer, are doing the challenge dose, and again it says or obtain challenge dose number 4, and then we have to wait at least 6 weeks. That's not negotiable. We can't titer before 6 weeks to see if you come back positive. It's okay if the titer is longer than 8 weeks, but it can't be fewer than 6. And then you're going to want to complete a release of information form to get a copy of your results. The MMR. So proof of immunity to the measles is mandatory for enrollment at Gonzaga. You very likely provided proof of this immunity to us, and it's in the health portal. Again, you saw the instructions for logging into that online health portal so you can obtain those records. On this standard, I want you to note the difference that says proof of vaccination or titer. If you have 2 doses of MMR, that is sufficient for meeting the standard for the clinical passport. You do not need a titer. And in fact, if you have 2 doses, I would use significant caution in getting a titer, because if you have presumptive immunity based on CDC standard if you have 2 doses of the vaccine. With this particular vaccine, mumps only converts in 88% of cases. So naturally, we just have a harder time getting people to be immune to the mumps with the vaccination. If you titer, there's a chance you're going to come back, 1 in 10, with not being immune to the mumps, but being immune to measles and rubella. And now, because you've titered, you have to address that. So if you have 2 doses, submit 2 doses and let that be, is our recommendation. In a few very rare circumstances, we might have a few students who received measles-only vaccines and not full MMRs. This is particularly likely for those of you who had childhood residence in foreign countries. We will need to follow up and pursue vaccination to address the mumps and rubella issues on that, but we can consult with you on a case-by-case basis there. Most of you are going to meet this standard with just proof of 2 doses, again available on the on the portal. Varicella and the chickenpox. Again, this is another vaccination where proof of vaccination or titer works. 2 doses, the timing that they're looking for there is at least 4 weeks or 28 days apart. Most students who were born in the 90s or after are going to have chickenpox vaccinations, might be listed as varicella. One quirk on this, you might have doses that are listed as MMRV. If you see an MMRV, that is a combined MMR varicella vaccination. It's not very common, but we do know we have several students who do have that as their varicella vaccine. So go ahead and look for that as well if you don't see your varicella. You only need a titer if you didn't have those 2 appropriately timed doses. So if you got chickenpox as a child, you probably didn't have 2 doses, so we'll need to titer you. And chickenpox is one of those things that once you get it, your body builds immunity, so you'll need a titer and you're going to probably come back positive. If you had 1 dose, you could still get the chickenpox, and if that happened to you, we'll need to do a titer. You're probably, again, going to be immune, but we can get you squared away. If you only had 1 dose and you didn't have chickenpox, then you probably need another dose. We can draw for the titer in health and counseling services. Again, $20 for the phlebotomy, health, Bulldog Bucks, student account, cash credit, and send your insurance card to the lab to the specimen with your blood. We do not carry this vaccine in health and counseling services. It's one that you would need to get at Safeway, Walgreens, any of the local pharmacies carry these vaccines, and usually on a walk-in basis. So you would need to get this vaccination elsewhere if you find that you do need to get a booster here. The TDaP, tetanus, diphtheria, and pertussis. Again, very important. Pertussis is a big deal right now. Certainly have a lot of outbreak with this. We've seen the standard evolving a little bit on this one. We've seen variations of this in the last couple of years. Some of them say on the clinical passport a TDaP is required once, with that TDaP dose having been received after age 11. And we've seen some that say TDaP required with a TDaP dose received after age 18. Follow whatever it says on your clinical passport. We're going with whatever guidance that you've got in front of you in the system when you log in to submit your information. Most of you probably had a TDaP around age 11 or 12. This would have been around that time that you're doing a kind of in your middle school years, you had a physical that you had to do. This would have been around then. One thing to keep in mind, you do need a dose every 10 years in order to continue working in healthcare. Look at when you've received your dose and the current requirement. It's very possible if you received your first dose or if you received your TDaP at age 11 that you're going to need one before the end of your GU career. You're going to need one when you're 21. You're going to need it when you're 22. Be aware of this. You may make the decision that since you're already looking at your vaccine, since you're already in the middle of this process, that you just want to knock it out. It is not going to hurt you to get a booster a little bit early. It's not going to hurt to have this come in a little bit sooner than the 10-year mark. So if you're coming up on it and you just don't want to have to worry about it, next February when it suddenly becomes due, you could go ahead and get that taken care of. We do carry the TDaP in our office, cash credit, Bulldog Bucks student account. It is also an immunization that many local pharmacies carry in their offices. Influenza. If you got your flu vaccine through health and counseling, again, that should be in the online health portal. If you don't see that on your record, call or email our office. We will verify. This is one of those things. The seasonal vaccines become available. They're usually released for use around July 1st every year, and so that's kind of the start of the season and the point at which you're going to need to go. If you haven't gotten a flu vaccine, you're welcome to come in for one, or again, pharmacies, etc. would be available to assist with that. Drug screening. This may or may not be a requirement based on the degree that you're working on. We're not able to conduct drug screening here in our office, and for this we usually refer students to an outside agency here in Spokane. Their information is listed there for you. One thing to keep in mind is that this is a cash or debit credit situation. They don't process insurance, but results are available fairly quickly for you to be able to get that done. Certainly, if you have another entity in mind or another place that you've found that service, you are welcome to do so, but we wanted to provide some information on a place we know you can get it done in case you need that. So, if you are totally confused having looked at all of this information, if you can't figure out your dates, if you've got an odd timing situation, if you're having a hard time interpreting your records, come on into the office, ask to meet with a triage nurse. We can give you some additional guidance, sit down with you. But what we really recommend is start with the clinical passport, sit down with that, and sit down with your immunization records and really start mapping it out. And then if you're still confused, bring all of that in with you, and we can review where you're at and see what we can do to guide you. Our hours are available there for you. We advise avoiding the lunch hour since it's a walk-in, and we have a lot of walk-ins during that time. If you have general questions about cost, vaccine availability, etc., you can email us at studenthealth@gonzaga.edu or call us 519-313-4053. I really hope this helped. It gave you some additional information. I hope it helped clarify what you need to be looking for. If there are any questions, please don't hesitate. We're here to help support to the best that we can, and I know your nursing instructors are as well. And thank you so much, and we're looking forward to having you all continue in your career progression to join us all in the healthcare field.